All right, so now we'll look at the respiratory system in greater details, this time focusing about the histological features of the respiratory system. Last time we looked at the respiratory system, that is considering the rib cage, the gross anatomy of the lungs, and also the movement of the chest wall. Now, we'll be focusing more on the histology, that is cells. What kind of cells are there? So just a brief review. So externally, so the respiratory system, we're starting from the nose, going down all the way to the lungs there. So externally, we have the nose. So the nose is divided into two parts, external nose and internal nose. The internal nose is what we call the nasal cavity proper. Externally, the nose is composed of the following. It has the alas. So these are the ala. We can call them the wings of the nose, these lateral parts. Then we have the apex of the nose. This is a pointed part of the nose. Then we have the nasal septum here. Anteriorly, we're saying it is cartilage. Posteriorly is bone. That is cartilage. Posterior is bone. Then this is covered in soft tissue. That is skin and some muscles. So that is a septum here. Then beside the septum is a nose trio, or what we call the nares, if it's plural, or nares if it's one. So that is a right nare or nares. This is the left nares. Then between the nose and the mouth, we have the philtrum. This is a shallow depression there, the philtrum. This is where most of the cleft lip occurs, the median cleft lip. Away from that, we have the dorsum. So this is the dorsum of the nose. This part here, that is the dorsum of the nose. Then we have the bridge of the nose. Separating the left eye from the right eye is a bridge of the nose. Then we have the root of the nose there between the eyebrows. So dorsum, separating the orbits, that is the left eye from the other. Then the root is where the eyebrows are positioned here, just in line with the superciliary lines. The superciliary lines will be above here, sorry. Superciliary lines will be above the eyebrows, but in between the eyebrows is the root of the nose. So that's what we see on the external environments. Equally, this is still the nose, now seen from the under surface. That is the septum. Then these are the nares, left and right nares. That is the ala of the nose. This is the ala of the nose. Okay. So we're saying respiratory system, of course, it's a system that processes gas for exchange. We have oxygen going into blood, carbon dioxide going into the lungs. Okay. So divisions of the respiratory system, we discussed this in the previous, session. I would refer you to that discussion we talked about when we were discussing the rib cage. So we're saying we have a physiological division of the respiratory system. We also have the anatomical division. Anatomical one is the one we talk about the upper respiratory tract and the lower respiratory tract. Physiological one is the one we talk about the conduction portion and the respiratory portion. So it's supposed to be portion here, no system. Respiratory portion. Okay, so those are the 4 divisions based on those 2 systems. Okay. So what I would want you to look at here is that as we are going down to the respiratory zone, we see that there are various changes, especially in number 1 is in the epithelium. As we are going towards the alveoli, we see that the cells are becoming more and more short. They begin as tall cells, which we call pseudostratified columnar epithelium. Then they keep on reducing in height. At some point, they will be cuboidal. So we sometimes fail to distinguish whether they are cuboidal or whether they are columnar, especially in the bronchioles. In the bronchioles, they are more or less cuboidal. So we just call them as tall cuboidal cells with cilia. Then as we go towards the alveoli, they keep on reducing in height as usual and end up as squamous cells. Similar things, if you start with the goblet cells, so these are the yellow cells here. You see some yellow spaces there. We see that there are a lot of goblet cells. By the way, these cells secrete mucus from the trachea in the bronchus all the way to the bronchioles. In the bronchioles, we see that there are no goblet cells. So they end in the bronchi. Goblet cells end in the bronchi, the segmental bronchi. When you go into the bronchioles, they disappear. So in the terminal bronchioles and respiratory bronchioles, we don't expect goblet cells. So there's no mucus being produced there. Mucus is only being produced in the large and medium-sized airways. Then we come to ciliated cells. So ciliated cells here, we see that they are also reducing in number from the trachea and end up in the respiratory zone. We see that going in the alveoli there, we don't have the columnar cells. They've disappeared. They've become squamous cells. Glands only end in the bronchi. Equally, so in the terminal bronchioles, respiratory bronchioles, we don't have submucosal glands. They are not there. Okay. Then we have hyaline cartilage. I explained this in the other session as well. To say hyaline cartilage, when you see hyaline cartilage, you're dealing with the bronchi. The moment those disappear, you're looking at bronchioles. So bronchioles don't have cartilage. Smooth muscle is there all the way to the alveolar ducts. So you see that smooth muscle is consistent, except in the alveoli. So in the alveoli, we don't have smooth muscles. Then elastic fibers is all the way to the alveoli. So even alveoli have some limited amount of elastic fibers. And remember, when we're discussing connective tissue, to say elastic fibers allow the structures that they are found in to expand and contract. That's the essence, and therefore lungs are able to do that. What we call lung compliance, ability of the lungs to expand, accommodate air, and contract to expel air. Okay. So this is a respiratory system as seen in one picture from the nose all the way to the alveoli. Okay. So we'll start with the nasal cavity here. Then we'll go into the pharynx. We'll talk about the larynx. Then finally, quick look at the trachea. So what is the function of the respiratory system in general? Number one, supply oxygen and remove carbon dioxide. Next is filter air. So the air that we are inspiring must be cleaned. Next is helps in the production of speech. Then receptors for olfaction. So ability to smell is a function of the respiratory system because of the cells found in the nose. Then helps to regulate blood pressure by removing excess carbon dioxide. Then gets rid of some excess water and heat. So as we are inspiring and respiring, heat is lost as a byproduct. At the same time, the air that we are breathing out is warm. So that is heat being lost plus water itself. Okay. So I beg your pardon, I have a call. Right, so those are the functions of the respiratory system. Then what is breathing? So breathing is a product of two processes, that is inhalation and exhalation. So one cycle of breathing involves these two, in and out. When air passes in and out of the lungs, that is called breathing. And you can measure that rate. You see that in adults, it's around 17, 18 per minute. Okay, but younger children is quite more than that, maybe 20 going up. Okay. Okay, these are just divisions we explained last time. That is upper respiratory tract and lower respiratory tract. Now let's look at the nose in detail. So this is the nose again, looking at those parts that we earlier mentioned. The ala, the apex, the septum, the dorsum, the root, the bridge, and the root up there. Okay. So we're saying the nose is divided into two parts, external nose and internal nose. External nose and internal nose. Now, here is a difference. The external nose, inside there is skin. This part here is skin, where the external nose inside is skin, whereas the internal nose inside is respiratory epithelium, what you call pseudostratified columnar epithelium. Okay, let me just turn it off. Pseudostratified columnar epithelium inside here, but in the external nose is skin, and that's why in the entrance of the nose there you see some hairs. We call those hairs as vibrissae. So vibrissae is hair, special hair found in the nose. This is a spelling here, vibrissae. Apart from that, since it's skin, it's also going to have sweat glands and also going to have sebaceous glands. We don't find these features inside the internal nose. Okay, so the point of division from internal nose and external nose is a skin fold here, known as limbus. So if you try to poke your small finger into the nose, you feel a lump. That lump is separating the external nose from the internal nose. We call that fold of skin as limbus. Okay. So those hairs called vibrissae are important because they trap dust, microorganisms, and anything that is in the air that we are inhaling. Okay. So that's all about the external nose. Nothing so special. It's just skin inside there. And it's the first part of the nose. Now, the internal nose, otherwise known as the nasal cavity proper, the real nose, is inside there. What is it composed of? So we see that, first of all, there are these three bones, as you can see. These three bone projections. 1, 2, 3. So we call these as turbinate bones. So these bones project from the lateral sides of the nose. We call them turbinate bones. Now, these turbinate bones are covered in respiratory epithelium, which is pseudostratified columnar epithelium. So once they are covered with epithelium, we call them conchae or concha if it's one. Conchae, if they are plural, you add E last. But if it's one, you just remain at A. Superior concha, middle concha, and inferior concha. But if you remove that, they are just bones. So we call them turbinate bones. So because of their shape, as air is entering through the external nose into the internal nose, air is made to make turbulence, like circulate. Now we see that this epithelium here has a lot of capillaries. Okay. Even in the roof here of the nasal cavity of the external nose, there are a lot of blood vessels there. We call them the Kisselbach's plexus. Kisselbach plexus. So the Kisselbach plexus helps to humidify the air. So as air is circulating here in the nasal cavity, tiny droplets of water diffuse from the capillaries to mix with the air, so that as air is being channeled through the pharynx into the larynx, this air is not dry. It has to be humidified and therefore prevents irritation to the pharynx and the larynx and all the structures down there. So that's why even when you're administering oxygen on the wards, in patients who are having, gaseous exchange impairments or conduction problems, you find that the oxygen given has to be humidified. It has to pass through some water medium so it doesn't cause any irritation to these structures. Okay. So that is the nasal cavity. These three bones, projections called conchae, superior, middle, and inferior. Now, we're saying, this part, the internal nasal cavity, is covered in respiratory epithelium. known as pseudostratified columnar epithelium, except for this part here, the superior nasal concha. So the superior nasal concha, part of the septum here, is covered with a different type of epithelium. That epithelium is known as olfactory epithelium. This epithelium gives us the ability to smell the air that we are inhaling. So olfactory epithelium is a special type of epithelium found only in the nasal cavity and enables us to perform the function of olfaction. So it is found on the superior nasal concha and the septum next to the superior nasal concha. So the middle and the inferior have respiratory epithelium, except for the superior, which has olfactory epithelium. So let's look at those two types of epithelium. Okay, so this is what we are looking at. So I'll start with, let's start with olfactory epithelium. So olfactory epithelium is similar to respiratory epithelium, which is pseudostratified columnar epithelium, except that in olfactory epithelium, we have the following cells. Apart from having those columnar cells, we have basal cells. You can see these purple cells here. So these cells act as stem cells. These cells act as stem cells to replace the following two types of cells, which are the support cells. You see them in brown here. These support cells are providing both mechanical and physiological support. So they are providing certain nutrients. They're also providing protection to these sensitive cells called olfactory cells. So these yellow ones are called olfactory cells. So olfactory cells are the ones responsible for detecting the type of smell or the type of odor in the air that we are inhaling. So three types of cells we mentioned in olfactory epithelium: basal cells, which are acting as stem cells to replace either support cells or olfactory cells. Olfactory cells are the actual cells of sense of olfaction. Then the support cells are there to act as connective tissue. So they are supporting the olfactory cells, both anatomically as well as physiologically. Then within the olfactory epithelium, we have glands in the submucosa there. So we call these glands as Bowman's glands, okay, or olfactory glands, if you like. So these are the glands here with their tube. You see that these are simple acini glands, simple acini glands. So these glands produce a jelly-like matter, and this matter is always on the surface of the olfactory cells and the support cells. So it creates this layer here. Okay, now this mucus layer is being formed by the mucus produced by the Bowman's glands. It is this mucus that traps the odor or the smell in the air that we are inhaling, so that these cells can detect it and transmit to the brain. So we see that olfactory cells are simply bipolar neurons. There's a topic we did on nerve tissue. We are describing types of neurons. We mentioned multipolar, bipolar, and unipolar neurons. So these are bipolar neurons. Dendrites on one end and axon on the other end. So these axons come from the superior nasal concha and pass through this bone known as ethmoid bone. The ethmoid bone separates the nasal cavity from the cranial cavity. And this bone has small perforations. Okay. These perforations, which we call the cribriform perforation. The word is here. Cribriform plate. And this plate has perforations where these nerves pass through. And we see that once these axons enter the skull here, they form synapses with other neurons, and then these neurons now leave as one nerve, what we call the olfactory nerve or cranial nerve number 1, which is a nerve responsible for sense of smell. Okay. So that's about the olfactory epithelium. Okay. which is shown here again. 3 types of cells: basal cells, also known as stem cells, support cells, and olfactory cells. Then we have Bowman's glands or olfactory glands. Then see that those axons are meeting to form olfactory nerve. Now let's look at olfactory respiratory epithelium. Respiratory epithelium slightly different from olfactory because there are no nerve cells in it. So we have columnar cells. These are the cells here, and see that they have cilia. Next, we have goblet cells. These are cells producing mucus. Then we have brush cells. These are cells that are able to sense some sense of taste. They work together with cells in the oral cavity. Then we have small granular cells, also known as Kuczynski cells. Kuczynski cells are also known as small granular cells. Then we have basal cells. Basal cells were present in olfactory epithelium as well. So these are small granule cells. So they are called small granule cells because they have a lot of granules in their cytoplasm. And these granules act as local hormones. So these are endocrine cells, isolated endocrine cells found within the respiratory system. So they influence or control activities of cells nearby, like goblet cells and columnar cells. Basal cells are there as stem cells. They will replace any of these other type of cells if they are damaged. Then we have brush cells and columnar cells. Okay, so that's olfactory epithelium. So the majority of the respiratory system is olfactory epithelium. Only in the alveoli there where we'll find simple squamous epithelium, and also in the superior nasal concha where we're going to find olfactory epithelium. Okay, so that's it about the nose, separated into two, external nose and internal nose. Okay. So some application, we have condition like anosmia and hypoosmia. Anosmia is complete loss of sense of smell. Hypoosmia is reduction in accuracy of sense of smell. We see this in patients who are elderly. So as we age, the ability to sense, is lost because cells are dying because of age. Then patients with upper respiratory tract infection, rhinitis, and the others, you find that is associated with some loss of sense of smell. Like, even patients who had COVID reported loss of sense of smell. It's because of destruction to this epithelium, olfactory epithelium. These cells are damaged. Now, because you have basal cells, quickly these cells will be repaired or replaced, and then the sense of smell is retained. But anosmia, maybe someone was exposed to noxious substances which completely destroy the entire olfactory epithelium. Then there will be no sense of smell, which is not really a very big loss if you think about it. As long as someone is still alive, at least they can do away with sense of smell. You can't die because you can't smell something. Let's look at paranasal sinuses. So we looked at the nasal cavity as being a cavity within the cranium, but there are other smaller cavities surrounding the nasal cavity, and they actually have connection with the nasal cavity. So small ducts connect nasal cavity to sinuses. So they are called paranasal because they are located around the nose. That is a nose, and then around it are sinuses. Now, these sinuses are given names according to the bone in which they are found. So we have sinuses in the frontal bone of the skull. We call them frontal sinuses. We have sinuses in the maxillar bone, which is the upper jaw. Therefore, we call them maxillary sinuses. We also have sinuses in the sphenoid bone. Remember, the sphenoid bone is where the pituitary gland is protected. So we call it sphenoid sinus. Then we have the ethmoid bone. Ethmoid bone separates the nasal cavity from the cranium or the cranial cavity. And it has small sinuses also. We call them ethmoid sinuses. So I'll run through them once again. 4 pairs of sinuses. Frontal sinus, maxillary sinus, sphenoid sinus, and ethmoid sinuses. Some books may call them orbital, paraorbital, because they are closer to the eyes, but I think nasal wins, because if you see, they are all surrounding the nose instead of going around the eye like that. Okay, so the epithelium found in the sinuses is the same. It is still respiratory epithelium, which is pseudostratified columnar epithelium. This one here. This is the one that will be found. Okay, now they also produce mucus, they have cilia, and the rest. Now, if infection spreads from the nasal cavity to go into sinuses, that's when problems begin to arise, because only small ducts are connecting these sinuses to the nose. So those ducts can be blocked. If there's infection, pus forms there, and then pus fails to drain. So what happens is that pus remains in those sinuses. Okay, so here we are seeing diagrams of sinuses. These are maxillar sinuses there. Then these are the turbinate bones that we talked about. Okay. Now, let me show you patient with sinusitis. Okay, here. So here the sinuses are clear. Here they are sinuses with infection and pus. So this pus blocks the opening of the sinus. So this pus cannot leave here, rather will stay there. Now, for a long period of time, this patient will have blocked sinuses. So they're going to have repeated and recurrent headaches, severe headaches actually. So, and if you palpate in these areas here, if you push your fingers here and there, you press, this person will be in serious pain. Then you know that they have sinusitis. So antibiotics help to clear them here and now, but if pus accumulates there, you need to drain it. So procedures are done where you create, through the nose, of course, you create perforations so that you can drain that. So you drill into the bone, drain the pus, and then infuse the sinuses with antibiotics. So that requires surgical approach now, because drugs cannot reach here. Even if you use nasal sprays, the sinuses are still blocked. So you just have to drain, because we are worried with infection spreading, especially from the ethmoid ones, going into the brain. This is the ethmoid bone. This is a cranium. This is a nasal cavity. Superior nasal concha, inferior nasal middle, and this is inferior. This is a sphenoid bone. This is where the pituitary gland will be. Sella tussica. This is a sella tussica where this pituitary gland is. This is a sphenoid bone. Sphenoid sinus. So if there's infection in the ethmoid bone here, ethmoid sinuses, that pus and infection will spread from the bone into the nearby brain and cause meningitis and encephalitis, which is a very serious complication now. So before that is done, drills can be done and drain the pus. Now, all these sinuses, when the baby is born, they are present, the sphenoid, the ethmoid, and the rest. But the frontal one only develops post-birth. So infants who are 1 year and below don't have this. Okay. We are not born with a frontal sinus. It is absent, but the other 3 are there. This one is absent. So if you have an X-ray and then you see that this part of the bone looks solid, there's no dark part, because dark shows air, then you're looking at an X-ray of a young person, an infant, someone who is 1 year and below, because this part has not yet been fully pneumatized. Pneumatization of the sinuses occurs after birth, when air now is passing through the nose. Some of the air goes into the sinuses and they begin to expand. Then this one is acquired at 1 year. Okay. what we call pneumatization of sinuses. Okay, next we look at the pharynx. So pharynx is just a tube and divided into three parts: nasopharynx, oropharynx, and laryngopharynx. So nasopharynx is posterior to the nose, oropharynx is posterior to the mouth, laryngo or hypopharynx is posterior to the larynx here, and it's a common passage for food and air. Food will pass through the mouth into the oropharynx, into the laryngopharynx, and into the esophagus at the back. Air will pass through the nasopharynx, oropharynx, laryngopharynx, and into the larynx, all the way to the trachea there. So we say this is funnel shaped. It is wide up here and narrow at the base. More like a triangle that is upside down. Wide above, then keeps on narrowing as we go towards the larynx. Okay. So what kind of epithelium is found in the pharynx? We see that the nasopharynx, we have epithelium similar to the nose. So it will be respiratory epithelium, which is pseudostratified columnar epithelium. Oropharynx will be similar to the mouth, which is stratified squamous epithelium, non-keratinized. Laryngopharynx will have epithelium that is similar to the mouth, stratified squamous epithelium, non-keratinized. So the two are same, laryngo and oropharynx, except for nasopharynx. So apart from that, it is surrounded by muscles, just like the digestive tract. It has inner muscles and outer muscles. Now, in the digestive system, we are saying the inner muscles are circular, the outer muscles are longitudinal. In the pharynx, it is opposite. The inner muscles are longitudinal, the outer muscles are circular. Okay, so the outer muscles are circular, the inner muscles are longitudinal. As such, you find that the larynx is guarded also outside now, it's guarded by connective tissue, which we are calling adventitia at this stage. So that's all about the larynx. Next thing we look at is larynx now. So next discussion will be about the larynx. Okay. So for now, we can safely end here. And remember, I'm always available for any questions and clarifications concerning these topics that we are covering, including previous topics. Okay.